So we've been sampling views on the streets, and we'll start with the Ghana Medical Association. Is the first on the probe with Benjamin Akakpo last night. Vice President Dr. Titus Bayo endorsed the review.
I think they are welcome reliefs, I'll put it that way, of the restrictions. We are happy with them. The Medical Association, we just completed our council meeting over the weekend, and it was a decision of the council that we thought that at this point, some of these restrictions needed to be lifted. If you look at the nature of the cases that are coming in, if we study the trend of the disease in the country now, there is a need for us to return some life to normalcy. In particular, we are happy that fully vaccinated persons do not need to be subjected to this testing at the airports, and I think that bit is very welcome. This COVID has given us a lot of positive lessons that if we do not make benefit of as a nation, we'll have ourselves to blame. It is for the first time that we didn't report any cases of cholera because of our hand-washing hygienes. Are we going to maintain this? We saw local industries build capacity to be able to produce and supply and meet almost all our needs in terms of PPEs. Are we sustaining that? We improved our ICU capacity from something that was very abysmal to a point that ICU beds became quite available. Are we sustaining this for other medical conditions that require ICU services? And our research institutions, and I'm very saddened, and I have to mention this here, when you look at some of the restrictions that some countries brought up, in particular United Arab Emirates, when they brought their travel requirements, the accredited labs in this country that they would accept results from, none of them was a public lab. And that's very disappointing. What happened to the KCCR, Noguchi, our public health reference labs that stood in for us? They made the initial diagnosis. How do we turn our back on these institutions and say that they are no longer fit to produce credible results that our international partners will accept? So I think we should not turn our back on those institutions that has helped us in the height of this crisis.
Fellow of the CDD and pharmacist, Dr. Sapon Asido, has also been endorsing the easing of restrictions as announced by the president. He, however, charges government not to renege in its attempt to ensure that the 20 million Ghanaians targeted are vaccinated. He spoke on the AM show.
Any disease state, the problem for public health managers is the link between infection, hospitalization, and death. Once that link is established, health managers have to do something about it. And that is why you have things like social distancing and other things coming in. So at the onset, that came in. Then the next level becomes, what else can we do to break this, which might be either treatment or vaccinations. So when treatments came in, they were not as effective. So link wasn't broken. There was a high probability that if you got infected, you get hospitalized, and unfortunately, you could get severely ill and die. Now we have vaccines, and that link has been broken. The president making that announcement was spot on. What we are left with now is to ensure that the dynamics that ensures that that link is broken are implemented, and that's our vaccination. And so for me, the challenge the Ghana Health Service has now that the president has made this announcement is how to ensure that the 20 million people are vaccinated, not just that, but knowing that immunity wanes after about 6 months to ensure that boosters can be efficiently employed so that our patient immunity is high. Because if our population immunity drops, then you have the added implications of imported infections, especially with our land borders open. We are where we are. You need to be vigilant. The president has made the political health decision. Now you need to make the prudent personal decision around self-protection, self-preservation, and vaccination. And you need to positively affect those around you to ensure that they get vaccinated. That is the only way around it.